Harim Jaffer. Today I am continuing my second lecture on smoking and periodontal diseases. Please subscribe to my channel, Dr. Harim Jaffer, Specialist Dentist, on YouTube to get more videos on these subjects. In the previous lecture, we described the classification of the smokers, and we explained the effect of the smoking on the prevalence and severity of periodontal disease, and the effect on the etiology and pathogenesis, and the effect on response to periodontal therapy. And we discussed the effect of smoking on the microbiology, on the physiology, on the surgical treatment, on the non-surgical treatment, also on the maintenance care of the patient. And we talked about that most of the efforts of the dentist should go to the smoking cessation methods, or helping your patient to quit smoking, because as we know that half of the periodontal disease are associated with the smoking. So it's a crucial risk factor we should deal with. So most of the effort of our practitioners and professionals should go to how to help the patient to quit the smoking. So how to help your patient to quit smoking? First of all, ask the patient about their smoking status. As we talked about previously, is he current smoker or former smoker? Is he heavy smoker or light smoker? So ask, at the first, ask. And this should be a part of medical history. Second, advise. Advise smoker of the association between oral disease and smoking. So be informative, honest, and helpful, but not judgmental. Don't judge your patient. The patient's response to this information will reveal their interest in quitting. Third, assess. Assess the patient's interest and readiness to attempt smoking cessation. Patients may not yet be in an action phase to quit smoking, which is why it's always important to make these assessments every time you see the patient. So it's a continuous process throughout helping your patient. Then assist patient in their quitting attempt. If you are trained, there are many techniques that can be used. And now we are talking about some techniques in a few minutes later. Then arrange follow-up or referral to the professional smoking cessation service. The most important aspect of this is to keep regular contact, particularly around the quit date and in the immediate period after. A simplified version that's particularly useful for the dental team is the AAR programs as follows: ask, advise, refer. So this is the arrangement. Ask the patient if they are smokers, and advise them regarding the association between the smoking and the other diseases. Then refer them to the patient's to the professional smoking cessation program. So you should make your patient go through these 6 steps: ask, advise, assess, assist, arrange, then refer. Then we have the methods or the ways of smoking cessation, which includes some of the points. One of them is set a quit date. This is very first step and is highly important. The patient must set their own quit date on which they will stop smoking and will remove all tobacco products from their environments. Then Willpower alone. Success rate at 12 months is 3%. This is the least effective method of smoking cessation, with only 3% of smokers managing to quit after 12 months. So till the 12 month, the 3% of the process should be ended at least. Other ways, self-helping materials. Success rate at 12 months is 4%. This includes a variety of literature and online resources that patients can access. The dental team can be helpful in providing literature and guiding patients toward resources they can access. For example, in the process of advice, you can enrich your patients throughout resources. Then brief intervention program in primary care. Success rate at 12 months is 5% to 10%. Brief advice is very important and should always be given at every dental visit. Enhancing the role of specially trained dental hygienists and prevention auxiliaries in giving lifestyle advice is of major benefits. If the dental team gave even brief advice to most of their smoking patients and achieved a low cessation rate of 5% over time, a significant proportion of smokers would be assisted to quit each year. Then we have nicotine replacement therapy, which we have its brief in NRT, nicotine replacement therapy. The success rate at 12 months of using this method is 10 to 20%. NRT generally doubles the success rate of smoking cessation. For example, in primary care setting in which brief advice is given, 12-month success rate doubled from around 5% to around 10% if NRT is used. In an intensive setting such as smoker clinics, success rate increased from around 10 to 20%. NRT is not a magic cure, but helps with carving and withdrawal when a person quits smoking. And although it does contain nicotine, it doesn't contain the toxic products such as tar and carbon monoxide that's present in cigarette smoke. And the NRT products include the following: patches, lozenges, nasal spray, and inhalers. The other way is bupropion. The success rate of this method is 20 to 30%. This medication is used as an antidepressant at higher doses, but is effective for smoking cessation at lower doses. It's usually prescribed starting 1 to 2 weeks before the quit date, initially at 150 mg once per day for 6 days, then 150 mg twice daily for 7 to 9 weeks. There are serious potential drug interactions, so this medication should be prescribed by the patient's medical doctor. And we have other methods. Whatever works for the patient is good, in addition to a combination of the above. Techniques for smoking cessation can include intensive counseling, motivational interviewing, cognitive behavioral therapy, hypnosis, and acupuncture. So these are the ways that we should take it while we're trying to help our patient to quit smoking or undergo smoking cessation. So as a brief, finally, we know that smoking results in dramatic increase of periodontitis and increase the likelihood of poor response to periodontal therapy. Non-surgical therapy can be successful in smokers if excellent oral hygiene is achieved, but surgical treatment, including implant placement, all have decreased favorable outcome in smokers. Smokers have less gingivitis and bleeding on probing, so it's more difficult to detect the attachment loss and bone destruction because it masks the clinical features. So it's imperative that comprehensive pocket depth recording and full mouth radiographs should accompany during the periodontal examination for all patients. Dental clinicians have a unique and obligatory responsibility to inform smokers of their susceptibility to advanced periodontal destruction and poor response to surgical procedure. The demonstration of specific smoking-related periodontal problem is often the first job that the patient should be informed and should accept while doing the treatment procedure, as we said, through advising the patient. This can trigger a desire for quitting smoking, and the dental team has a special role in initiating smoking cessation. NRT or nicotine replacement therapy and behavioral modification approach generally have 20% of success rate. The addition of systemic medications such as bupropion and varenicline may add another 10% of quitters at 1 year. But because of the occasional serious side effects like seizure, arrhythmia, tachycardia, and etc., it is suggested that these agents may be best prescribed under the direction of physician. So, smoking cessation should precede periodontal surgical intervention. This is important and crucial point. And if patient continue to smoke, clinician may consider limiting periodontal treatment to non-surgical approach, accompanied by rigorous short interval 2 to 3 month maintenance visit until the smoking will cease. So, my friends, we should know that the smoking have a very adverse effect on the general health, especially on the periodontium. So, my advice for you is that you should try your treatment plan first of all with the cessation of smoking or quitting of smoking before undergoing any surgical procedure. But if the patient can't quit, so you should have a short-term interval of seeing your patient, like 2 to 3 months, and you should have a follow-up or maintenance care for your patient age 6 months until the patient will convince to quit smoking. I hope you have a nice day and have a good time, and I hope that you enjoyed this lecture, and I'll see you in the next lecture. Thank you.